Our lecture for today will be about the arrangement of artificial teeth, class 1. So this will be the start for the setting of an artificial teeth. This week we will discuss class 1 in terms of arrangement of artificial teeth in natural occlusion and in lingualized occlusion. And then after the lectures will be discuss the setting of artificial teeth in class 2 and class 3, and of course with the natural occlusion and lingualized occlusion. The arrangement of artificial teeth in class 1, the setting of teeth in natural occlusion, of course, starting with when setting the teeth in natural occlusion. First, an upper central incisor is placed to one side of the central line. After determining the bisecting line using the incisive papilla and the center of incisive papilla, as we discussed previously within the landmarks that aid in positioning of artificial denture teeth, the first tooth to be placed is the upper central incisor is placed to one side of the central line, replacing the labial contour of the upper wax block and just touching the occlusal plane, as at the image on the left side. So the working within the occlusal blade, so we substitute the lower bite with the blade, making sure that occlusal incisal the incisal of the upper central incisor, the incisal edge contacting the occlusal plane. Now then the lower rim or a glass slab placed against the upper block is used to indicate the occlusal plane. Now the lateral incisor then placed in a position, of course the inclination of the central will be upright with the occlusal edge contact the occlusal plane, or a glass slab, whatever it is, the flat surface on it, which measuring the placement of the anterior teeth on it. Then the lateral incisor will be positioned just behind the central incisor and should be positioned within the incisal edge, of course, 0 to 2 millimeter of the occlusal plane. This will be vary as at the image on the right side. The average or the positioning of the incisal edge away from the occlusal plane, it depends on many factors regarding the age. For example, this will vary according to the age of the patient. The older patient would not normally be expected to have a youthful step, as in the image on the right side. It's between their central and lateral due to the wear of the central and canines, so it seems to be that the lateral within the level of central and the canine. However, with the youth people, they are between 13 to 30 to 40. This will be placed within the reduction or within the elevation away from the occlusal plane between 0 to 2 millimeter. Now the centrals and laterals would have their incisal edge placed more anteriorly than their necks. This to support the lips in a slightly prominent and natural position. Well, this, of course, represented by the alignment of teeth within the in a position in neutral zone over the alveolar ridge. The canine should be positioned then to show their mesial aspect when viewed from the front, and the incisal edge should just touch the occlusal plane. So at the image on the left side, we position the canine uprightening in a way that the mesial side the mesial aspect more prominent because the canine is the key of the arch and is the turning point to start the setting of posterior teeth. Now, the distal aspect should be pointed down the wax blocks to link into the posterior teeth, of course, and create a natural looking buccal corridor. The neck of the canine should be prominent and more anteriorly placed than the incisal edge to emphasize the canine eminence and to support the lips as at the image on the right side. So the position of the canine will be slightly prominent. By setting up one entire side of the anterior teeth first, rather than two centrals, followed by the two laterals, and finally two canines, the labial contour of the block can be maintained until one side is correctly positioned. Otherwise, putting the two centrals in one step, there are many theories regarding the setting of teeth in terms of starting with the maxillary anterior teeth. So it has been recommended to use one side and then the other side because sometimes we have asymmetrical arch. So focusing on the two centrals then to the laterals and canine give us a false setting in term of probably away from the buccolingual width that we have to position the teeth, and also in terms of the alignment of the long axis of the teeth over the alveolar ridge. Now the upper posterior teeth then start to position as well in a way that they sit over and slightly buccal to the ridge, such that their occlusal surfaces lie slightly buccal to the lower ridge. Now the teeth are positioned to create a compensating curve. The compensating curve, as we mentioned previously, this compensating curve qualify the curve of spi anterior-posteriorly and the Christensen's phenomena in the natural teeth. And the steepness of the curve depends on the condylar angle, the cusp angle of the teeth, and the incisal guidance table angle. The steeper the angle, the steeper the compensating curve needs to be. The curve of spi anterior-posteriorly curve of the posterior teeth should match the condyle angle to maintain the contact between the teeth in a protrusive excursion. Now the upper first premolar then positioned with the palatal and buccal cusps contacting. Many theories conducting that the first premolar should only the palatal or only the buccal cusp contact. But in terms of simulating the masticatory functionally, and to avoid any discrepancies within the protrusive and the lateral and excursion movement of the mandible, it has been recommended that the first premolar, that the buccal and the palatal cusps should contacting the closing plane. Okay, the long axis of the tooth is vertical when observed from the buccal aspect. Now the second premolar is positioned, and again with the vertical long axis when viewed buccally, but with the buccal cusp lifted slightly off the occlusal plane by almost 0.5 to 1 millimeter, and this depends on the anatomical landmarks of the artificial teeth. Only the palatal cusp touches the occlusal plane. Now what we have, the central touching, the lateral touching the occlusal plane, the lateral away between zero point 0.5 to 2 millimeter, depends on the age of the patient. The canine touches the first premolar, the buccal and the palatal cusps touching the occlusal plane, and the second premolar only the buccal, the palatal cusp touching and the buccal cusp lifted slightly. Now, with the molar, the first molar tooth is positioned again with the mesopalatal cusp contacting the occlusal surface, and the remaining cusps lift to continue the compensating curve started by the second premolar. That means the mesopalatal cusp give a functional articulation, and the other cusp lifted in a way that the buccal probably lift zero point 0.5, the buccomesial lifted 0.5 millimeter, the distobuccal about 0.75, and the of course the the distal buccal cusp will be elevated a little bit, about 0.5 millimeter away from the occlusal plane. Now, the lower the the way that the mesopalatal cusp is for this molar will be the nearest to the occlusal plane, and the distobuccal cusp the farthest away, as I mentioned previously. Now, the lower molar then positioned in a term of intercuspation with the upper first molar. This way is the best for the beginners with the setting of teeth in term of controlling the way and the position and the setting of each tooth. So in this theory, our students will start to position the lower tooth to occlude with the upper, such that mesopalatal cusp of the upper tooth occludes with the central foci of the lower teeth, as in the image on the right side. Now, the lower second premolar is placed to occlude with the upper second and first premolar. So this relation, natural occlusion, is the tooth to two teeth relationship. Finally, the first premolar are placed to occlude with the upper first premolar and the distal aspect of the canine. Now, the second molar, the second molar tooth should only be placed if there is room to do. So, without placing them over the sloping part of the ridges, that means at the maxillary tuberosity or the retromolar bud in the lower, then which would cause denture instability. Placing the last molar tooth would mean it was over a sloping part of the mandibular ridge, so it has been omitted. This image showing the intercuspation of the molar, intercuspation of the molar, and particularly the first molar, the first tooth to replace in the lower or the mandibular artificial teeth, and then the second premolar to position in between the upper first and second premolar, and then the first premolar, which is positioned between the distal slope of the canine and the first premolar. Now, the lower anterior teeth, in term of setting of teeth in natural occlusion, the lower anterior teeth should be positioned to create an arbitrary 1 to 2 millimeter overjet and overbite. The overjet is the distance between the palatal surface of the between the incisal, the difference between the incisal edges in terms of upper and the lower anterior teeth. While the overjet is this is the overbite. The overjet is the distance between the palatal surface of the upper anterior teeth and the labial surface of the lower anterior teeth. In case of class 1, of course, in term of class 3, maxillomandibular relationship, this will be different. This will be negative overjet. Now, always remember to ensure that the force generated when incising food are directed down through the anterior teeth onto the alveolar ridges, which effectively pushes the dentures against the ridge for maximum support. Now, whether this it is essential for the setting of teeth in term of natural occlusion, tooth to one tooth to two teeth relationship, or intercuspation, then it depends on the case here. We will discuss later on in after setting of class artificial teeth with a class 3. We will discuss if there is a limited space for us, if there is no space for us to place the full arch. There are many guidelines to follow. Now, all of these steps has been done for setting the artificial teeth in natural occlusion. But what about the longulized occlusion? In terms of longulized occlusion, that means we have many cases when we need to make the teeth were located lingually in terms of resorbed severe resorption of the edentulous arch. So, of course, the upper anterior teeth are positioned as previously we mentioned as in the natural occlusion. When using longulized occlusion, the lower teeth are usually positioned first. Uh, uh, in class 1 longulized occlusion, the as I mentioned, is first of all the lower posterior teeth were positioned, and we should follow all the guidelines regarding the occlusal table. The last occlusal table should be with the slopest area within the lower, and that's why probably most of the dental technician finding that the setting of teeth in longulized occlusion a little bit complicated, but after many experience and dealing with such cases, maybe they become a professional in dealing with the setting the artificial teeth in longulized occlusion. Now, the contour of the lower ridge is drawn along the side of the model using as previously we mentioned in previous lecture, using the compass by detecting the slopest area and the position on which the last occlusal table will be within these two lines. Now, the occlusal plane of the lower posterior teeth should conform to the curve of the lower ridge, which is the first molar tooth position to be over the lowest point of the ridge, as that within the image on the left side. We identify the area, then positioning the teeth. So whether we are using the molar or we have a short ridge or a short residual free end, or in case of limited space, or we want to compensate the stability of the denture, this will be limited within these two lines. Now, this can sometimes lead to a shortened occlusal table, as at the image on the right side. We just use, as you can notice, that the canine, there is one premolar and one molar, and then this is the shortest because otherwise we cannot occlude the teeth in a position with the upper in terms of longulized occlusion. The highest of the occlusal plane may need to be adjusted carefully to ensure that the upper posterior teeth do not appear to be hanging down below the upper anterior teeth. uh, when the patient open their mouth or smile. So ensure that the upper posterior teeth do not appear to be hanging down below the lower anterior teeth when the patient open their mouth or smile. Ensure that the central foci of the lower posterior teeth are directed over the center of the lower ridge with for example tools like a static laser, for example. Now the upper posterior teeth can then be positioned. The teeth are positioned so that the large palatal cusp of the second premolar and first molar occlude with the larger central foci of their lower counterparts. Now, this situation is reversed with the first premolar, where the large buccal cusp of the lower first premolar occluded with the central foci of the upper first premolar. There is, for example, no overlapping for the posterior teeth seen. For example, in terms of lingualized occlusion. The teeth should be positioned so that they are forced directly at right angle to the ridge. This may mean that they deviate slightly from the occlusal plane and do not conform to the normal compensating curve. The occlusal plane is used only to regulate the correct height of the posterior teeth. Ideally, the largest posterior tooth, the first molar, should be placed over the most stable part of the mandibular ridge. The best analog for this is a saddle on a horseback. Okay, as at the image on the right side. Now, as I previously mentioned, the arrangement of the teeth can often lead to fewer posterior teeth being placed compared to the natural occlusion. There are a number of options that can be employed in the circumstances. To aid the stability of the denture during protrusive movement, for example, a reverse first premolar, which is called the spare premolar, can be placed behind the last lower molar, as in the image on the left side. This acts as a locking when during the mastication, the compensating curve, to avoid sliding of the upper arch from going downward and fall downward, and the lower arch protruded anteriorly and then fall as well. This tooth is not in occlusion at all because the occlusal table finally was with the molars, and you can notice that the tooth relation is tooth to tooth relationship. And this tooth not in occlusion during normal mastication excursion, but will occlude with the upper molar during protrusive excursion and when incising through food. This negates the effect of Christensen's phenomena, a disocclusion of the posterior teeth in protrusive excursion, which is in the natural teeth, and provide balanced occlusion in this excursion. Now, to increase the size of the occlusal table as well, the upper first premolar can be substituted for the upper canine, for example. The lower canine is then positioned to occlude with the central foci. Now, the lower canine is then positioned to occlude with the central fossa of this tooth by angling the premolar outward a little more than usual for a canine. It it is possible to hide the palatal cusp and make this tooth to all intent and purpose of canine. This usually has no determined effect, of course, on aesthetic. The image on the left side showing that the canine has been substituted by the premolars to increase the size of the occlusal table. No, it is also possible to substitute molars for premolars as the image on the right side. This has the effect of increasing the occlusal table. And this has happened only with the lingualized occlusion, setting of teeth with the lingualized occlusion. This to increase the occlusal table, also by reducing the buccolingual width, as this may be lead to cheek bite due to the functioning, and because of the occluding of teeth and with the lingualized occlusion, it make them more efficient at cutting through the food bolus, therefore exert less pressure on the underlying tissue and bone. And of course, we are always looking for narrowing the occlusal table in terms of substituting the natural teeth with the artificial teeth. Now, the lower anterior teeth are positioned according to the lower ridge, and upper anterior teeth function should normally be given preference over aesthetic. Therefore, accommodation may need to be made when placing the lower teeth to maintain denture stability. Although the overjet and overbite should not be exaggerated, it is important that the lower teeth remain in the neutral zone. Look, dear students, the lower teeth within the longalized occlusion should remain in the neutral zone and are not positioned to create an arbitrary 1 to 2 millimeter overjet and overbite. So we have to modify the overjet and overbite. It should be noted that the dentures made using this technique may not be symmetrical about the midline. This is of little consequences and is a result of following the anatomical structure of the mouth. Dear students, now what we have with the lingualized occlusion term of setting of teeth, with the in natural occlusion and lingualized occlusion, and I'm sure that you will focus on these steps because we have to set the teeth in set the teeth in terms of natural occlusion and in terms of longalized occlusion. And do not forget that the natural occlusion, the relation between the upper and lower teeth, artificial teeth, is 1 tooth to 2 teeth, while in longalized occlusion the relation is about to be 1 tooth to 1 in the counterparts. The quiz for next week to be prepared is to how can you arrange the mandibular artificial teeth in class 1 relationship. Okay, this will be, of course, if I didn't mention in natural occlusion or longalized, you will focus on the setting of these teeth in class 1 natural occlusion and longalized occlusion. Thank you for today, dear students. Be ready for the quiz for the next week, and thank you for today.